Now let me introduce you to our Director of Counseling, Health, and Accessibility Services, Dr. Linda Koenig.
Most of what we have done has focused around either case management activities, which is contact tracing, either individually providing guidance to people or trying to follow what the CDC and the state of Ohio ODH, all the recommendations that are coming out, trying to keep on top of those, synthesize them in a way that makes sense for Shawnee State and applying them on campus. When we say case management, we basically are talking about folks who have been in quarantine because they're exposed or they're sick or they've tested positive. And that number that the health team has dealt with across the pandemic is 2,812. We've actually had over 100,000 outgoing communications. So I didn't even count, what we've had incoming. But most of those, the bulk of them has been either in encrypted texting or emails, answering questions and giving test results and giving individual guidance. The next thing that we added was COVID testing. And we have PCR testing through the clinic and KDMC, but in the fall of 20, we were able to start offering rapid testing. So from the time that we started, we have done rapid tests in the amount of 4,307, and that's accurate as of yesterday. And then the other thing that we've engaged in, which came along after case management and came along after rapid testing, is vaccination. So we were really excited in April of 21 to become a vaccine provider. Administration at Shawnee State was really supportive, and they really wanted to be able to offer that service to our students and to our faculty and staff. And not only that, but also to be of service to the community if we could possibly do that and do anything to make the pandemic better or to decrease the negative impact of the pandemic. We have offered vaccinations here on site. We've offered them off site in the campus community, and I have a couple of numbers for you. We have given 1,846 vaccinations over the period of time that we've been providers, which is right at about a year and 3 weeks at this point. One of the things that we're most proud of is the fact that our residential students at Shawnee State have a vaccination rate over 98%. So we have very few students living in residence halls who are unvaccinated. We also, when we look at our faculty and staff, our non-student faculty and staff, we're looking at a vaccination rate of about 75%. And when we look at everyone overall, we're knocking at the door of that 70%. And, we're hoping that we can maintain that into the coming year. So that has pretty much kept us really busy. If it wasn't case management, then it was rapid testing, and then add on, vaccination. So we've got this multi-layered approach at this point where we're trying to do prevention. And if prevention fails, then we're trying to minimize the impact through vaccination so that folks are not ending up in the hospital and not having, long-lasting effects from COVID.